This is the nasal. This is frontal, parietal. Behind that is squamosal, behind the ear. In the back is occipital. And then underneath is the occipital condyles. And then the first vertebrae is the atlas. And then the axis. And underneath here is articular. And then here is angular. And then there's hyoid on the floor.
Do we have to know dental at all? Or dentary?
Yeah. Well, this would be where dentary is, and then maxilla would be here, and premaxilla would be the tip.
Terrific.
Vertebrae. These are
Thoracic
vertebrae. These are the lumbar vertebrae. This is the synsacrum, or the sacral vertebrae. This is the caudal vertebrae, and that's the pygostyle.
The pygostyle, awesome.
And then this is the humerus. This is the radius. This is the ulna. And I don't think you can see the carpals and metacarpals.
Oh, right.
That would be the carpals. This would be the sternum. This would be the carina.
The bridge on the sternum, yeah.
And then these are the unsnate processes. The little things that hold in the ribs.
Mm-hmm.
And these are the ribs. And then this is the ilium. Right there. And we assume this is the ischium, and then the pubis
It's kind of broken
is
off
kind
a
of
little.
missing.
How about the rear legs? The hind legs?
These?
Mm-hmm.
This is the femur. This is the tibiotarsus. And then this is the tarsus metatarsus and the phalanges.
Terrific. I think that's all of
This is the
it.
scapula. This is the clavicle. This is the coracoid. And then missing right here would be the patella.
In the kneecap region, right?
Yeah, that would be the knee.
Skeleton on the jaw. We have the mandible, the molar, the premolar, the incisor. Here we have the nasal, the premaxilla, the maxilla, the frontal. The optic foramen is this hole inside here. Then we have the squamosal and the parietal. And then we have the atlas and the axis, the cervical vertebra, the thoracic vertebra, the ribs, the lumbar vertebra. We'll stop there.
Vertebrae, caudal vertebrae, scapula, clavicle, humerus, sternum, xemphoid process, cranian process, radius, ulna, carpals, metacarpals, phalanges, ilium, ischium, pubis, femur, fibula, tibula, patella, tarsals, metatarsals.
Cat skull, we have premaxilla and maxilla, and here we have incisors, canines, tricuspids, and bicuspids. This is the mandible. We have our angular process, condyloid process, and coronoid process. Moving up, we have a nasal, frontal, parietal, and then we have lacrimal right inside here, squamosal back here. We have the tympanum bullae here, mastoid process, occipital condyle, and then underneath we have our palatine, presphenoid, basis sphenoid, and underneath the palatine is the vomer. Okay, for axial skeleton of the cat, we start with our occipital condyles. And we have our atlas vertebrae that has two transverse processes. Then we go to our axis vertebrae that has one spinous process. The rest here are cervical vertebrae. We have thoracic vertebrae, lumbar vertebrae, our sacral vertebrae right here, and the rest are caudal vertebrae. Off of the thoracic vertebrae, we have true ribs, costal cartilages, manubrium. In between these costal cartilage is a sternobrae. This is the zippy sternum, and the xiphoid process. Alright, so the scapula, we have the scapular spine. In between here where the humerus articulates is the glenoid fossa. This is the humerus, radius, and ulna. At the top of the ulna you have the ocrinon process. Below you have your carpals, metacarpals, and phalanges. Articulating with your sacral vertebrae, you have your os coxa, which is split into your ilium, ischium, and your pubis. Where the two pubises meet is called the pubic symphysis. Where your femur articulates with the os coxa is the acetabulum. So you have your femur, patella, fibula, and tibula. Here is the calcaneus. Then we have our tarsals, metatarsals, and phalanges.